Hello, and how are you? Welcome to our nursing case study series. And in this lesson, we're going to focus on the home visits. So if you're new here, my name is Winnie Barawa, and this channel looks into lessons, lectures, and expert interviews talking on healthcare or discussing healthcare topics. So if you've been following, we've been doing a series on nursing case study, and we have been looking at the different parts, the components, and how to write. So we've begun all the way from the component and the introduction part. We looked at the significance or the importance of doing a nursing care case study. And we've done several parts like physical examination, history taking. We have looked at the literature review, or what we famously know as the disease description. And in this segment, we are just going to give it all on home visits. How many visits are we supposed to conduct? And in all this visit, what is expected of us? So please, I ask of you that we be with me all the way to the end. Comment on our videos, leave a feedback. How do you find them? Are they educative? Do they really meet your needs? And you can also add up into what you've touched on. If it's something that you feel you want to say on or comment on, feel free to leave us a comment below. So let's see, what about home visits? For home visits, these are conducted upon discharge of the patient and is accompanied by a visit plan or a visit schedule, which you align with the objective of each visit. So how are we supposed to bring this part comprehensively? So this is the stage where we now come in after the disease description have been done comprehensively, that is the literature review. And in the last part of literature review, we mentioned that we need to do health education or client teaching. And if you've not watched that video, guys, I will attach a link here so that you can be able to access it and listen to it. So in the home visit, this is the stage that comes in after the patient has been discharged. She's been taken through the health education part. But now we want to continue this management in their home city. So what are we supposed to do as a nurse or a student at this level? We're supposed to generate a visit plan or a visit schedule that is aligning the objectives for each visit. So someone may ask themselves, fine, I want to visit my patient, but after how long should I be repeating or going back to check on them? So different books will give you different outlines, or in the different institution you belong, they may have different requirements for visiting this client. But now the time schedule, 7 days to 10 days is usually a good fit. However, you need to check the severity of your patient or the critical needs of this client. In some cases, you may take lesser days for you to go back, but 7 to 10 days is a good fit for you to start on, because this gives you or gives your client time to implement the issues you've discussed together. The client is able to check on any needs that you are not able to identify on that particular day that you came. So it allows basically enough time for our patient to readjust, to implement the interventions we've agreed or the management you've agreed during the visit. And when you come back to check on them again, they'll be able to give you good progress. All right. So the home visits, they're normally, organized into 4 visits in the nursing care planning. So we have the first visit. Normally, this is the initiation visit or the assessment visit. And then we have the second visit and the third visits, which are usually the working phase here. So here we are working on implementation of the agreed management that we agreed on the first visit. And as we do the follow-ups, the second visit and the third visit, they are more of like follow-ups visit, reinforcing of the management and agreeing on the next steps. And then on the fourth visit, this is the termination visit. We are basically working on, did the visit work, did the management got effective, and what is our next step after the home visiting has ended? What is the termination phase? How are we terminating this visit? So we shall discuss one visit at a time. We see what is normally engaged in each, and then you can be able to clearly see how to state this. So before going into details in elaborating the different visits, number one, we need to remind yourself, what is the purpose of home visits? So the purpose of the home visit are broad, but most of the time is for the purpose of assessing the patient health, the home environment, and the patient family situation. So we visit this client more so in the first visit. We go into meeting our clients, but the main purpose is to do home assessment or community assessment, where we want to see, the patient health status after discharge, the home environment, the family situation. And then as we're doing that, as we go to meet this client, we're also going to be providing nursing care services, including things like health medication, health education, health promotion, further physical exams and checkups. They are part and parcel of these home visits. Then you can conduct health education or client education in their home setup. And this health education this time is not on the patient only, but we are extrapolating it also to the family members or any other person who lives with this patient. And then there's improvement of compliance to treatment. So the purpose of home visits, especially for clients who are on long-term medication, it really works positively in improving their compliance to the treatment and ensuring that they stick to the treatment plan. And then the other part is enhancing trust. That if the client feels like now they can trust you more, they're able to actually identify with the management that you're giving them, they become very cooperative. So it ends up at the end of the day promoting trust. But they also relief from hospital trips. It's a cut cost or saves cost because the client doesn't need to be coming to the hospital all the time to just get to be reviewed for their treatment or to be reviewed for their illness. So you can just review them from home, save on their cost, and be able to offer even personalized care. So what is personalized care? Personalized care is care offered to a client that caters for their personal needs or individualized needs. So with home visit, this is able to be achieved optimally because it's a one-on-one management. There's no interference with other clients, and it's just the nurse and the patient at that particular time. It also fulfills follow-up. Remember we say client management comes up with follow-up, especially after discharge. However, if we emphasize that the follow-up has to be through the clinics in our facilities, then some clients may fail to show up, what we call defaulting. So eliminating defaulting in this case allows us to actually have what do we call it? It allows us to have assured follow-ups for these clients because they will show up in the facility. Not like they will, I mean, the nurse will show up to the patient homes as opposed to when the client has to come to the facility. And then it helps us to fulfill our planned scheduled visits. Remember, before the patients, we start them on home visits, we need to develop the schedule. And this home visit schedule is normally stated with the objectives and what we shall be doing in each and every visit that we go to see our patients. As we conduct the home visits, there are certain principles that should guide us, and one of it that the health visit should be regular and flexible. From the beginning, we said when we're doing this segment of home visit, we will need to develop the schedule for how we are going to conduct the visit. So like to write first visit, at what date are we going to do this? What objectives are we going to achieve in that visit? If it's a second visit, when is that date particularly going to be and the objectives in it? So the regular state here is the client can know in advance what time you will be coming to meet them and what are the specific objectives that you're going to look into. But then there's the need for flexibility. Flexibility is quite important because it makes the patient also feel they have the rights to participate in decision making regarding these home visits, but it also gives us the option to have changes made in case those dates are not able to be met. But the other part is as we conduct our home visits, they should be educative, meaning this client teaching should keep on ongoing. And you will see as we do the different home visits, there are certain tools that are quite needed and necessary for us to have as we do home visits. And one of it is a lesson plan. That as we go to visit our client, you need to have a lesson plan that will be showing which topics you're going to discuss with our patients, which model of teaching are we going to use, do we have any diagram, do we have any tools that we wish to use. Then it should be convenient. By convenient means you do not need to make the patient feel uncomfortable just because you're going to visit them in their home. It should be convenient. Ask what time the client is present or is fully available so that you don't need to make them cancel their own plans for them to fit you in. Then respect patient rights. As much as the home visit will be guided mostly by the nurse, it is your responsibility, or it is also good you remember the patient has rights. For example, they have the right to autonomy, that as much as you've decided together that these are the home visit, they can also talk to you about consent and why they may not wish to be part of the visits. So allow them to have rights that they should be practicing freely without coercion or without the nurse, imposing their own thoughts and not allowing that client to give their thoughts. Let's talk about the first visit. And in this first visit, what are the key takeaways or the key activities in it? So in the first home visit, we also call it the initiation or the assessment phase or the assessment visit. In this visit, our main purpose is to go meet the patient family and their community. And in here, we are going to describe the findings and identify the problems that were found from the family or from their community. So there is actually an aspect where we are going to do priority needs identification. So in the needs identification, as the nurse or the student who is conducting this case study will be needed to actually develop a description in terms of different subtopics. For instance, you'll be needed to talk about the occupation of the clients or people in the community, common conditions, the environment, the healthcare services, availability of food, waste management and sanitation, water supply. In here, we want to describe the basic key essentials that seem to be important in that particular community. So we'll be describing the findings that were made from the assessment, but also you don't forget to give the progress of our patient since discharge. Remember, when we agree on this date, when we are going to meet our client in their homes, the first thing is to check that progress, number one, but also in the first visit, it is to do an assessment. We want to assess the status of our patient since we discharged them. But then we want to go assess the needs of our patient from their home settings. So first visit, we do not do a lesson plan here. Majority of people confuse first visit by doing a lesson plan. We are not going to do any lesson planning in the first visit. We are only going to focus on assessing the needs of the patient. So after that visit, the report that you're going to write is going to be describing the finding or the key needs identified from the community. So I'll be describing their occupations, their key illnesses and conditions that are present, the environmental status, the healthcare service availability, waste food management, waste management, sanitation, water supply, like talk about key components that are essential for that community that you found out either the community practices or the community uses. So that's what the first visit does. Here you will avoid the lesson plan. You do not need it here because you're not teaching them yet. You want to identify these needs, which will be our next key part in the next visit. That is where now we shall be coming to teach about them, or rather we are going to be addressing them. So avoid your lesson plan at first visit, focus on assessing this client and writing a report on the identified needs. Then we have the second visit and the third home visit. So in the second home visit, we are assessing patient progress, of course, since the time we visited them in the first visit. We are going to provide care if there's any needed care, be it wound dressing, is it medication, is it counseling. We're providing all that care that is needed. But then this is where now health education begins. So based on the needs that we checked, from the previous visit of visit one, we want to start introducing the topics. So in these topics, did you identify that there's a gap in nutrition and you want to talk about nutritional diets? Did you identify there's a gap with water and sanitation? And so you want to talk about water and sanitation. We introduce our health education. And from this second visit, you then come up with action points or action plan. What are we going to do after here? So that when we come to the third visit, we are going to check on if the progress has been made. So in the second visit, we're supposed to health educate the client, but after health education, that's not the last part. We need to bring in action points or action plan. Next steps, what are we supposed to do? So that when we meet in the third visit, we're going to be following up on what we agreed on, and we are going to now continue from there by either continuing the provision of care, doing further health education, or do we prepare for termination? So that's what second visit does. But the third home visit here, we're going to assess the patient progress and follow up on the agreed action points that we agreed in the second visit. We will continue with provision of patient care if they still need for it. And patient care here is any key interventions like wound dressing, physical exams if maybe there is need for one, administration of medications. These are key patient care that can be done at home also. But we shall also identify another topic that you're going to do as health education as we prepare for the termination visit. So remember we said the home visit gap, we can schedule them like 7 days apart or 10 days apart, depending on what is convenient and flexible enough for our patients. So the third visit is a follow-up visit also, looks into healthcare provision and health education. But remember, this is the visit that you are going to do before we terminate our visits with the patient. So you have to be very focused, trying to make sure that all the needs of our patient are properly met or are adequately met, because after this, we are terminating the visits with these clients. And our final visit is the fourth home visit that we also calling termination visits. So the fourth visit is normally a confirmation of patient restoration of health. So this is a follow-up visit, but also it's a last visit for this client. So what we do here, we are going to reassess. So there's reassessment of our client and confirmation of the health that it has been restored. So in this case, you want to see if the nursing goal have been met and you're planning for post-visit activities. So what are the post-visit activities? In post-visit activities, we are looking at recording and reporting or report writing. We want to see how we are going to do summary and conclusion. So that's what fourth visit is about. Some people opt to do another health education session here, which is still fine. But on my opinion, I feel on the fourth visit, there shouldn't be much of health education, but more of summarizing here. You want to summarize the visit together. I would rather do a health education recap, not a new topic. There's a difference between recap and just pure health education, where you're just introducing another topic. So you can do a recap to trying to review the previous lessons that you've done with them to see if they have implemented, to see if they have understood, instead of us introducing a totally new topic, which will be quite difficult for us to monitor, because we shall not be coming back to see this client. We are terminating them. So for the fourth home visit, we are terminating our client. We are doing final assessment to see if the target was met, if the goals were implemented, and the patient health has been restored. So you want to confirm restoration of health. You want to confirm the nursing goal has been met, and you're planning for termination or other post-visit activities. So here we have the recording and reporting, summary, and conclusion. So that's what the fourth visit does. So how are we going to compile this? So we'll be compiling one visit at a time. I know you may be tempted, you want to do a report of all the visits. No, a visit is well reported if you do it within 72 hours after the conduction of the visit. So if you did a visit today, then make sure 2 or 3 days later we've already reported this visit and a follow-up has been done by your supervisor or the person who is working with you if you're a student. So don't be overstaying with a visit and you start reporting it like weeks when you are literally into the next visit. It will not make sense, because if your supervisor is trying to check on your efficiency, they're not able to confirm that with that current report because it's already invalid, it has expired, and they're not able to do any amendment in case there is need for one. And so thank you for staying with us always to the end. Don't forget to give us a like on this video. Give it a comment also. Tell us, do you understand it? Do you enjoy it? Do you have a question? We will always answer you in our chats, and share this in your platforms. Remember to subscribe if you've not done yet, and also join our channel as a member. We have different levels of membership and you can choose the one that works for you. So until we meet again, thank you very much and bye bye.